Thank you very much. Good afternoon, everyone. Let's get going with the numbers provincially. 2,994 2,094 cases increased from yesterday to today. This has been in the 2,000 range now for a couple of days. Now the average is about 2,000 days moving forward. 2,000 per day moving forward. Again, Ottawa had 132, and they too were in the 150 zone over the last couple of days as well. Peel, Toronto, York, obviously the bigger numbers. And we had a very busy weekend, unfortunately, as well, when it comes to our data. We currently have added over the weekend, I think it was I fell off my chair when I saw it was 84 cases over the weekend. And we have really looked at a rolling average that's really gone up. As you can see, we're right now, we're in the 80 range on average for the Eastern Ontario Health Unit, even higher for SDNG. And so this is, worrisome trend. Again, it went down a bit, but if you look at our trends, we're really not even close to the red line down here. We're really high up. So we need to, again, just keep an eye on that. Among those cases and those situations that we've had, obviously, we've had 205 of which are VOCs. The provincial percentage of VOCs is about a bit less than 60%, and we're at 67% right now. We're steadily going up, so clearly more than 2/3 of our cases are VOCs in our area. And we just continue to ensure that our protocols are in place, and so on. And we have an enhanced contact tracing mechanisms in place, and so on. So it's we're up there. We just today started the red, so I'm hopefully we'll see some decrease over the next week or so moving forward. But again, we're quite high here. We're actually approaching gray zone, which is quasi lockdown as well. So I don't want to go there. Obviously, we want to stay in that area. In terms of our outbreaks, we've got 10 outgoing outbreaks. 80 have been resolved. I've got it updated here. It's going to be updated. I've got 35 hospitalized actually, and of which 5 are in the ICU. So that's going to be changed. Again, there's a disconcordance between what's in there and what we get in real time. So that's why what I have here is more accurate in terms of what we get here rather than in CCM, because we get this real-time reporting very late in the day from the hospitals. That's how I have the latest one here. And so one of the things that I'm looking at in terms of our outbreaks, and again, I'm looking at them again, and aside from one at this point in time, which is the McConnell Manor, where we still have 2 active cases among the original 13, and we have 2 active cases among workers and so on among the 14 that were positive. And so that is the only one that has residents that are positive. All the other outbreaks do not have residents in them. The outbreak at the Hawkesbury Hospital really continues with a total of 27 patients and 5 staff. Outbreak there. I know there have been some tragic event that occurred there last week. We don't have any comment except to say that this is a tragic event. I have a lot of questions in my media briefing questions here. We cannot comment further on that. It's just a tragic situation, and I know that they're investigating, and our hospital staff are devastated by this, as of course are the families, and we express our condolences there. But again, I can't comment any further in that regard. In terms of our schools, we have at this point 35 active cases, getting a lot more cases in our schools. That's increasing, and again, we see that a provincial trend. Again, none of these started schools; they're really from the community into the schools, and then we trace and isolate what's involved. So that's something that we need to keep an eye on as well. And again, just in summary, We are, by all indications, our reproductive number, our positivity rates, our 7-day rolling average are all in the increase, which are not good signs. We are having a hard time with our staff in terms of being able to catch up with all of the contact tracing. Again, 85 over this past weekend. So again, just pleading with everybody to please adhere to these most of these again are gatherings that we see, and then it spreads into the household. We also see social gatherings that we've seen. We've also seen gatherings at workplaces, but not with clients, but among staff themselves, that during breaks, don't take the precautions, and that's where they get it. Then they go home, and then that's why the majority of our cases, although they start in those in clusters of those, they end up more as close contact, household contact, because one individual, especially when it's VOC, the whole house gets infected. It's quite hard to limit it once it's in a household. So we need to continue with those VOCs. Again, the number of long-term care and retirement home outbreaks are going down, but what we're seeing as well is a slight tendency of younger age groups now being infected and younger age groups being admitted to hospital. Seems that the variants may be causing a bit more severe disease than the original version, so that's something we need to take care of, to be aware of. Now I'm going to go to vaccines and talk a few things. As you may have heard, one of the things that was released just now in terms of NACI, and we're waiting for AstraZeneca. We do not have any AstraZeneca in our area. We were supposed to get AstraZeneca at one point for our pharmacies and primary care practitioners, but that's going to be probably in the next week or so. The NACI, the National Advisory Committee of Immunization, has actually just cut out a statement and recommended that AstraZeneca be only offered to people over 55 years of age. I just got it right now, and I haven't even read the rationale behind that, but I just wanted to share that with you. In terms of our vaccines moving forward, again, all of our appointments are fully booked from between March 17th and the April 9th. We've got over 12,000 booked, and so those are booked, and we have now again delivered over 23,000 vaccines, if not more, because we have not included in our count some of the hospital ones. We always maintain about a 3,500 overage for the following week, because we always, when I reported last week, we reported about 28,000 received and about 24,000 or so being delivered, and we have an inventory of about 3,500 that we're keeping, because don't forget, we had a clinic today and we have 2 clinics tomorrow, and we usually get the Pfizer vaccines delivered either late on Monday or on Tuesday. So that's why we always rotate that. Over the weekend, we were also given our allocations. We will have a bit of an increase, not as much as I had expected, but there will be a bit of an increase in our allocations, and we will be moving forward. Now, just want to address the 70 plus. Over the weekend, we were asked if we wanted to start getting 70 plus, and we had said we were not ready because our clinics were fully booked, and it would take us a couple of days before we started sending in. We had to add more clinics. What we're doing now is to the 20 that are existing. We have 20 right now. Between now and the first week of the 9th, we're going to be adding a few other clinics and adding more capacity in some of the clinics, opening up more spots. And we just wanted to ensure that that was transferred properly to the ministry, so they would go in. We wanted to double check that they were in, and so that's why we didn't opt to go in over the weekend as of today for 70 plus, but it will be imminently over the next couple of days. People will be able to book 70 plus for us. We didn't want to go open it up for 70 plus and not have places, and so we now, because we don't, like this point, we're finished. Our clinics are booked, but we will be adding. So as they go in, I've asked the ministry to expedite, putting them on, and we'll make sure that they're all open, and want to verify it as we move forward. So very shortly, we will be taking appointments for over 70. age moving forward, and we're adding the clinics to that. Now we have our allocation, so we know, so we're now planning for the next month or so after the first week of April moving forward. So at least there will be spots for people when they want to make an appointment. The other thing that I just wanted to say again to remind people is that for First Nations are included in phase one, which we are in now. We're partially in phase one, finishing that off, and now into phase two with the age groups. And so it's as follows for unreserved First Nations, for example, for Akwesasne, they vaccinating all adults in their area because of increased susceptibility. But I also want to remind people that for Indigenous populations living off reserve, 50 with the age, we are vaccinating 55 and over. We have reached out to Aboriginal organizations and First Nations organizations in the Eastern Ontario Health Unit area, and I've shared that. So I just wanted to share that one once more, remind people of that at this point, because we've got some questions in that regard. Donc, bonjour tout le monde. On va commencer avec nos chiffres quotidiens. On a augmenté de 2094 cas depuis le jour précédent en Ontario, et ceci représente, comme le même chiffre il y a quelques jours, de 2500, dans la moyenne de 2000 par jour. Donc, c'est une augmentation importante depuis quelques semaines. Donc, on voit ça toujours en augmentant. Toujours ce Peel, Toronto, York qui mène. Ottawa avait 132 et Ottawa aussi commence à augmenter au niveau des cas quotidiens. Au niveau de notre région, nous aussi, on n'a pas de bonnes nouvelles parce qu'on augmente aussi au niveau de nos cas. On est rendu à 332 cas actifs et donc nous avons 10 éclosions, je vais en parler tantôt. Et comme on voit ici au niveau de la moyenne mobile, on est toujours vraiment dans la rouge, on approche la zone gris. Une fois qu'on approche le 100, on part de zone gris, mais là, on est 97 à SDNG, mais à la moyenne, on est à 86, donc c'est pas mal élevé. Vous voyez, la ligne rouge est ici, c'est à 40, donc on est vraiment dans le rouge et on approche le gris ici. Donc, ça, c'est un peu décourageant. Quand on voit ça, on voit que la plupart des cas sont des cas qui arrivent avec des personnes qui se rassemblent ensemble. Ils font des rassemblements, ils s'infectent, et puis après ça, ils rentrent à la maison, puis ils infectent toute la maison. C'est ça qu'on voit. Et 67% de tous nos cas sont les variantes, qui sont beaucoup plus faciles à transmettre d'une personne à l'autre. Nous avons 250 en total des variantes dans notre région. Et tout, sauf une, sont la souche britannique. Et donc, ce serait très important de continuer parce que nous savons que les souches, les variantes sont beaucoup plus faciles, sont transmissibles beaucoup plus facilement et sont transmis plus facilement. Et aussi, semble-t-il que ça donne un peu plus des maladies sévères, les symptômes sévères. Donc, on voit plus en plus des personnes moins de 60 ans, 50 ans qui rentrent à l'hôpital à cause de ça. Donc, c'est très important de continuer avec toutes nos précautions parce qu'on voit que ça ne va pas dans la bonne direction en général. Non seulement nous, à le restant d'Ontario aussi, malheureusement. Donc, au niveau des éclosions que nous avons actuellement, nous avons une dizaine d'éclosions dans les maisons de longue durée et des maisons de retraite. Juste une parmi les autres, tout affecte les résidents. Toujours, c'est le McConnell Manor avec 2 actifs résidents, toujours sur les 13 originales. Et le variant, c'est positif dans cette centre. Et nous avons encore 2 actifs au niveau des employés qui étaient positifs initialement parmi les 14. Les restants des éclosions dans les maisons à longue durée et des maisons de retraite n'ont aucun résident positif. Donc, ça, c'est des bonnes nouvelles. Par contre, c'est juste les personnels et semble-t-il, ils sont tous en contrôle. Et on a quelques-unes qui ont le VOC, les variantes. Au niveau de l'hospitalisation, on parle malgré que nos sites web donnent différents chiffres, on est rendu à 35 patients hospitalisés, donc 5 aux soins intensifs. Nous recevons la liste initiale, finale à peu près à 4 heures. Et sur le site du ministère qu'on voit, ce n'était pas rendu encore. Donc, ça va changer, mais ça, c'est le chiffre que nous avons actuellement. À l'hôpital d'Hawkesbury, on a des occlusions avec 27 patientes et 5 employés qui sont positifs. On sait qu'il y avait des événements tragiques qui sont en investigation actuellement. Je ne peux pas donner des commentaires spécifiques, juste pour dire que c'est des choses tragiques et nos condoléances vont aux familles. L'hôpital est en choc et je ne peux pas donner plus de détails ou des commentaires. J'en ai reçu pas mal avant aujourd'hui pour des questions du média. Je ne peux pas plus répondre à ça. Au niveau des écoles, nous avons actuellement, attendez, je vais le trouver ici, 35 cas actifs dans nos écoles avec 3 occlusions. Puis on voit que ça commence à augmenter. Et encore, c'est un signe de transmission communautaire qui est en hausse actuellement. Donc, je vais parler un peu des vaccins actuellement. Donc, je veux juste pour dire que AstraZeneca, on vient d'avoir des mises à jour de NACI, le comité qui donne les conseils au niveau des vaccins en Canada, que AstraZeneca doit être donné qu'aux personnes plus que 55 ans. Je viens d'avoir l'annonce actuellement, donc je n'ai pas d'autres nouvelles. Il faut dire qu'on n'a pas d'AstraZeneca dans notre région encore. Semble-t-il qu'on va l'avoir dans quelques semaines pour les pharmacies et pour les médecins de soins primaires, des cliniques de soins primaires. Nous avons vacciné pas mal plus que 23 000 personnes dès la semaine au niveau. Et puis, il nous en reste à peu près 3 500 doses qu'on reste pour cette semaine parce que nous recevons nos vaccins, soit lundi soir ou mardi des fois. Donc, on garde toujours quelques mille pour qu'on puisse avoir pour la semaine prochaine. Nous avons eux aussi nos allocations. On n'a pas beaucoup d'augmentation, mais on a une idée maintenant d'ici jusqu'au 10 mai. Donc, on est dans une position de mieux de planifier les autres cliniques parce que jusqu'à date, on a planifié les cliniques qui terminent la première semaine d'avril, soit le 9 avril. Et à ce moment-là, jusqu'au 9 avril, nous avons déjà booké à peu près 12 000 patientes. Et donc, tous les 37 cliniques sont bookées, sont pleins. Donc, à ce moment-là, nous sommes en train de préparer pour les prochaines 4 semaines et nous allons nous allons ajouter quelques autres cliniques et nous avons augmenté le débit dans quelques cliniques aussi pour qu'on puisse être prêt pour le 70 et plus. Comme vous savez, le fin de semaine, hier, en effet, c'était annoncé hier soir que plusieurs régions en Ontario vont avancer pour les personnes qui pourraient prendre le rendez-vous qui sont plus que 70 ans. Nous aussi, on était approchés le fin de semaine, mais nous avons décidé de ne pas le faire dès lundi parce que ça nous prend quelques jours parce que, comme j'ai dit, on ne voudra pas ouvrir les cliniques, ouvrir à 70 ans et plus et ne pas avoir la place pour les personnes de prendre des rendez-vous. Donc, on va ajouter. Donc, qu'est-ce qu'on va faire? On va ajouter des cliniques après pour les dates jusqu'au 10 mai à peu près. Et nous allons, entre-temps, d'ici le 9 avril, nous allons ajouter quelques cliniques et nous allons ajouter quelques places, des centaines de places à plusieurs autres cliniques. Donc, ça prend quelques jours pour être sûr que tout va dans le programme du ministère de la réservation. Donc, c'est pour ça que nous avons choisi de ne pas de ne pas annoncer tout de suite pour le 70 ans, mais ça va venir dans 1 à 2 jours. On travaille de façon étroite avec les ministères qu'on peut tout mettre nos rendez-vous en place parce qu'on ne voudrait pas que les gens trouvent qu'il n'y a pas de place. C'est pour ça qu'il y a un délai. Donc, nous aussi, bientôt, on va donner les rendez-vous pour 70 ans aussi dorénavant. Donc, on va l'annoncer aussitôt qu'on sait que le système marche pour prendre les rendez-vous, parce qu'on ne va pas avoir le même problème qu'on avait à chaque fois qu'on change les dates. Que les âges, vous savez, le premier avec 80, 75 ans aussi, il y avait des cliniques qui manquaient, donc on voudrait être sûr cette fois-ci. Je veux juste dire aussi qu'au niveau des Autochtones, les personnes autochtones aussi, ils peuvent, à Akwesasne, on reçoit des vaccins pour toute personne là. Et aussi, nous avons des vaccins. La première phase, on vaccine les Autochtones aussi qui demeurent en dehors d'une réservation, donc qui ont plus que 55 ans d'âge. Nous avons communiqué avec plusieurs agences pour communiquer le fait. Donc, je vais juste le souligner encore, je vais juste le partager parce qu'on avait des questions, donc c'était pour une clarification. So I'm just going to look at some of the questions here. Most of them, again, are about the Hawkesbury Hospital. La plupart, on a pas mal au niveau des hôpitaux d'Hawkesbury. On a une question de 70 ans. Je l'ai répondu. I had a question about 70. I also answered the question about numbers. I have another one here. Is there any... Are there any U.S. Of the AstraZeneca being allocated? I answered that as well. There is not much else I can answer from these. These are all related to the Hawkesbury Hospital. So, Jenna, I will open to the questions, please.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul.
Hi, Philip.
I've got 3 questions. 2 of them are really short ones, though, I hope.
Okay.
Sorry. The first one, at what point do we move from red to gray?
I knew you'd ask me that.
Of course you did.
I knew somebody would ask me that. Listen, there is no real limit to it. We usually look at the 100 mark, but we also look at other things. We look at ICU admissions. We look at increasingly growing percent positivities. We also see increased reproductive number, and we also look at our hospitalizations, which now, like then, our hospitals are full, pretty full, not overwhelmed, but like I said, our hospitals are many of our hospitals are have a lot of patients. Like Cornwall has 18 patients. Others have 13 in our area. A couple in the 3 in the ICU, and so on. So we look at those numbers, and we also look at our capacity to follow up on the contact tracing. We've been overwhelmed with the contact tracing numbers. Just like I said, over the weekend, if you look at how many cases, hundreds of cases that we've had to, actually a couple of hundred cases that we've had to follow up, each one of them with contacts and so on, with a bit more of an enhanced approach. So when we look at all those, that's what the decision is. So we'll be keeping a close eye on that. We will be meeting with the Chief Medical Officer of Health. It's usually a Tuesday or Wednesday to look at the trends and see when is it appropriate to go to gray zone, or if we're seeing numbers stabilize and go downwards. Again, it's just the first day we're in red, so let's see what happens over the next 4 or 5 days as well.
Okay, thank you. The second question, the ones that are hospitalized right now, do you have kind of a breakdown by age or gender? Like, is it pretty spread out across all ages?
It's pretty spread out. Look, it's pretty spread out. I printed the wrong printout, but I had it before. I was looking at the ICU admissions. Most of them are elderly, but we have a few people born in like 1970, 50, 60 age group, but still mostly the age group. But we are seeing, just on first eye, I'm seeing that more are in the younger age group than they used to be. Let's put it that way.
Okay, thank you. And the last question I have, Easter is this weekend. Mm-hmm. And the week after that is the 1 week spring break that was originally moved from March. Given that the infection numbers and hospitalizations now are higher than they were when they made the decision to postpone March break, what do you think should be done with March break? Should be canceled, further delayed?
Well, that's a good question. There's 2 ways going about it. There's no question we're seeing more and more school cases. And, even without the spring break, you got to question yourself and say, okay, what's going on? There's a lot of disruption in the schools with the enhanced protocols, Philip, where we have to isolate more kids. There's more disruption, more kids staying at home, more kids being tested. If that becomes an increasingly non-manageable thing, we have to look at that in the first place. And that would be something that we would have to look at very carefully in terms of, do you continue school in that regard because it's such a disruptive thing. The reason that we, wanted March break not to happen was because in the face of even lower numbers, what we saw on Christmas, those things went up. But there's two different things going on here. If you keep them in school, are you keeping them in school because because it's such a disruptive thing? And don't forget, we're at different periods of infection rates at this point than we were when we made the decision about March break. And so this is the context has changed. So we got to revisit that. Like I said, it's coming to a point where you might welcome a spring break just to give a break, because what's happening is that there's so many kids, going to school that we have to isolate so many kids. It comes from the community that it may be sensible to have a spring break. So again, it's a very complicated question, and it's not as straightforward an answer now that I would have given you a month and a half ago when we didn't have these levels.
Okay, thank you very much.
You're welcome.
Our next question comes from James Morgan, The Review. Please go ahead.
Oh, Doctor, I've
Hi,
got a
James.
couple of questions here about leftover vaccine doses.
Mhm.
I heard that at the end of the day, there are sometimes leftover doses.
Mhm.
What's done with those?
Oh, we have people on a waiting list. We call them and they get them. We don't throw them away.
Okay, well, I didn't think they got thrown
No,
away.
no.
No,
We James, we are very careful with Pfizer. We're able to we really manage the dose by dose, literally, and we know that, okay, we have so many people. This is how many vials we need, because we can get 6 out of the vials. Actually, my staff have got 7 from some. I don't know how they do it, but they get 7 anyway. And so when we get that, when we go there, it's very tight. So but sometimes we have a couple of vials that have a couple of doses left, because for that, and we always have people on standby.
Okay. So I guess that was my next question. Could people be put on a waiting list to get these leftover doses? And
Yeah, we do. We have a waiting list of people that are pre-registered that are still phase 1 and wouldn't able to get an appointment. Yes.
Okay, great. Thank you.
You're welcome.
Our next question comes from Thomas Stockton, TBC 22, who asks, we are seeing that health authorities reporting that people aren't turning up for their vaccine appointments. Is this an issue locally?
No, not so far. Not so far. As a matter of fact, people are eager. They show up an hour earlier.
Thank you. Next question, Natasha Wood, Nation Valley News. Please go ahead.
Hello?
In the meantime, do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. And Natasha Wood is reporting that her mic is not working currently. And we don't have her question in the chat box. So those are all the questions for today, Dr. Paul.
Thank you very much, everyone. Merci.